When does ovulation start and what are the signs of ovulation? Welcome to today's video, where we will be discussing ovulation, when it starts, and the signs you should be looking out for. Ovulation is a crucial stage in the menstrual cycle, and understanding your body's signals can help you make informed decisions about your health, fertility, and family planning. Did you know that ovulation happens once every menstrual cycle, usually around 12 to 16 days before your next period? It's the process where a mature egg is released from one of your ovaries, ready to be fertilized by sperm. And although it might seem like a small event, it actually plays a significant role in your reproductive health. But how can you tell when ovulation is happening? Here are some of the most common signs of ovulation that you should be aware of. Firstly, let's talk about your basal body temperature, which is your body's temperature when you're at complete rest. During your menstrual cycle, your basal body temperature initially remains low, but after ovulation, it rises slightly and stays elevated until your next period. By tracking your basal body temperature daily, you can identify when ovulation occurs. Another sign of ovulation is a change in cervical mucus. As you approach ovulation, your body produces more estrogen, causing the texture and color of your cervical mucus to change. During ovulation, your cervical mucus will often become clear, slippery, and stretchy, similar to raw egg whites. This change in consistency helps sperm swim more easily towards the egg. In addition to changes in cervical mucus, the cervix itself also changes during ovulation. The cervix is the passage between your uterus and vagina, and its position, firmness, and openness change throughout your cycle. During ovulation, the cervix becomes softer, more open, and higher up in the vaginal canal, changes that can be detected by checking your cervix with clean fingers. You might also experience breast tenderness or mild discomfort around your ovaries during ovulation. This sensation is known as Mittelschmerz, which means a middle pain in German. This pain is generally mild and can last for a few minutes to a few hours. While not all women experience Mittelschmerz, it can be a helpful indicator of ovulation for those who do. In addition to physical signs, ovulation predictor kits, OPKs, can also help you to identify when you're ovulating. These kits work by detecting a surge in luteinizing hormone, LH, which occurs about 24 to 48 hours before ovulation. By testing your urine daily, you can identify the LH surge and predict when you're most likely to ovulate. Now that we've covered the signs of ovulation, let's talk about the timing of ovulation. While every woman's menstrual cycle is unique, ovulation typically occurs around the midpoint of the cycle. For example, if you have a regular 28-day cycle, ovulation is likely to occur around day 14. However, it's important to remember that the timing of ovulation can vary, so tracking your body's signs can help you to pinpoint your most fertile days. If you're trying to conceive, knowing when ovulation occurs is essential because the window for fertilization is relatively short. An egg can only be fertilized for up to 24 hours after it's released, while sperm can survive in the female reproductive tract for up to 5 days. This means that the ideal time for conception is during the 5 days leading up to ovulation and the day of ovulation itself. In conclusion, understanding when ovulation starts and recognizing the signs of ovulation can help you take control of your fertility and make informed decisions about your reproductive health. By paying attention to your basal body temperature, cervical mucus, and cervical position, as well as using ovulation predictor kits, you can better predict when you're most likely to be ovulating.